If they replaced saturated fat from animal sources with unsaturated fat from plant sources, rates of heart disease plummeted. If they replaced these calories with whole grain calories, rates of heart disease plummeted. There's obviously a lot of evidence.
So you cannot get those essential nutrients that you need for life from plant foods.
I can only show you a small sampling because there's just too much literature.
And you really have to rely on review papers that have done a good job of weeding through good and bad trials. And when you do that, you find there's little or no rigorous evidence for the vegan-vegetarian diet.
Hey everybody, this is Klaus from Plant-Based News. Thank you so much for watching. So the following clip is of Dr. David Katz, a physician from Yale University, who talks about the evidence behind the health benefits of a whole food plant-based diet. After he speaks, his claims are refuted by journalists called Nina Teicholz. Check it out and let me know what you think.
So let's just talk about randomized controlled trials of vegetarian vegan diets. And as I do this and I pull up these text boxes, so significant reductions in lipids and inflammatory markers with the portfolio diet, that's a vegan diet. Every one of these randomized controlled trials I'm about to show you compares a vegan or vegetarian diet to an omnivorous diet. And in every case, what's in the blue box is verbatim from the paper, so I'm not editorializing here. So basically, a vegan portfolio diet lowers lipids as effectively as a statin, and the omnivorous counterpart diet did not work as well. This study shows that a vegetarian diet was more effective than a non-vegetarian Mediterranean diet at lowering LDL cholesterol. This, and again, all randomized controlled trials of various sizes. Cardiovascular risk reduction was optimized by a high carbohydrate, meaning a high plant food. By the way, carbohydrate is plant food. All plant foods are carbohydrate sources. So there was a better effect on lowering cardiac risk markers with a plant-based low glycemic diet than a meat-based low glycemic diet. And again, it's a little hard to see from this angle, so forgive the turning. TMAO is trimethylamine N oxide. It's a potent atherogenic metabolite. This randomized trial of multiple diets showed that the only way to reduce TMAO was to take meat out of the diet, so when meat was replaced with plants, TMAO plummeted. This randomized trial shows that a low-fat vegan diet improved glycemia and plasma lipids more than conventional diets recommended for diabetes by the American Diabetes Association. This randomized trial showed improvement in insulin sensitivity. Beta cells are where insulin is produced through a low-fat plant-based diet compared to an omnivorous diet. This randomized control trial showed that reducing saturated fat intake is associated with reducing intrahepatic fat. Fat in the liver leads to insulin resistance. This was really interesting. It was an overfeeding study. Saturated fat produced more fat in the liver than overfeeding the same number of calories from sugar or anything else. This randomized control trial compared, it was a feeding study, basically a hamburger versus a vegan meal of comparable calories. There was impairment in gut hormone responses and increased oxidative stress after the hamburger, but not the vegan counterpart. This randomized control trial shows vegan, vegetarian diets all better for reducing the dietary inflammatory index, a potent marker of chronic disease risk. This randomized trial shows in patients with coronary disease, a vegan diet lowers high sensitivity C-reactive protein, a potent inflammatory marker. This diet shows that diet quality scores increase significantly on a vegan diet, but not counterparts. That's important because these diet quality scores, the AHEI, alternate healthy eating, I realize this is a lot, I'm sorry. These in turn correlate with all-cause mortality, cardiovascular disease, cancer, type 2 diabetes. This randomized trial shows greater weight loss in the vegan group compared to the omnivorous group. This randomized trial shows more, again, weight loss compared to an NCEP, that's the National Cholesterol Education Program. This randomized trial shows plant protein produces particular improvements in body composition during weight loss. This study showed that plant-based protein is as good at controlling hunger and satiety as animal protein during a weight loss experience. Another randomized trial, reduction in intramuscular fat with the vegan but not the omnivorous diet. Another randomized trial, mean BMI reduction greater with whole food plant-based. These researchers go on to say they think this is the greatest weight loss seen at 6 and 12 months when you aren't specifically restricting calories. Another randomized trial, perhaps the most famous, Dean Ornish, randomized trial, patients with coronary disease. This was a randomized trial. I don't know if people realize this, but here a plant-based diet caused actual regression of coronary atherosclerosis. That's shown on top. The bottom images are PET scans. They show cardiac metabolic function. The orange is normal. Left is before, right is after the lifestyle intervention with a plant-based diet. These images show the effects of the same plant-based dietary intervention. This is from the Cleveland Clinic. And the Ornish study went out 5 years, and at 5 years, the folks who had this plant-based diet intervention, they had further regression of their coronary plaque. The control group had twice as many cardiac events. That's MIs, sudden cardiac death, admissions to the hospital for heart failure. And we don't need to decide that this is rigorous evidence. The Centers for Medicare and Medicaid Services have already done that for us. They've concluded that this program meets the intensive cardiac rehab program requirements set forth by Congress, and Medicare reimburses for this program of plant-based nutrition as cardiac rehab and as an alternative to coronary bypass surgery. This interesting randomized trial shows improvement in mental health with a vegan diet as compared to omnivorous controlled diet, depression, anxiety, et cetera. This was a multi-site intervention at work sites. This is just a sampling of randomized controlled trials. There are many more. It's already too much to show you. I apologize for the pace of this, but it's the nature of the enterprise. Now let's look at systematic reviews and meta-analyses. I'll go through these very quickly. So these are exclusively meta-analyses, systematic reviews. Most of them are meta-analyses of randomized controlled trials. Some of them are meta-analyses of cohort studies, and some a combination of the two. So there is some variation in the mix here. I'm just trying to carefully watch the time. So this shows an association in meta-analysis between vegetarian diets and lower blood pressure than with omnivorous diets. Omnivorous diets, of course, diets containing meat, eggs, and dairy are the control in every instance. This meta-analysis shows vegetarian is associated with lower levels of high sensitivity C-reactive protein. This meta-analysis shows reductions in multiple markers of inflammation, including C-reactive protein, fibrinogen, leukocyte concentrations. This meta-analysis shows lower mean concentrations of serum cholesterol on vegetarian vegan diets. Another meta-analysis, substituting meat with high-quality plant protein associated with favorable changes in blood lipids and lipoproteins. Again, these are mostly meta-analyses of randomized controlled trials. Another one, vegan diet is associated with more favorable cardiometabolic profile. Another meta-analysis, the portfolio diet reduces the 10-year risk of coronary heart disease. This is a vegan diet. Another meta-analysis, vegetarians have significantly lower ischemic heart disease and mortality. Another meta-analysis, lower risk of colorectal cancer in the vegetarian and vegan diets. Another meta-analysis, inverse association with vegan diets and diabetes risk. Another meta-analysis, diets that produce the highest scores, these various measures of diet quality, have the lowest levels of all-cause premature death, cardiovascular disease, et cetera, and the highest score on these measures is a high-quality vegan diet. And another meta-analysis, significant protective effect versus the incidence and mortality from ischemic heart disease and cancer. Okay, just a sampling, all right? It is just a sampling. All right, now, I want to argue, so I'm a scientist, I've done this my whole life. I want to argue that although these are the objective standards of high-quality evidence, I don't know that they necessarily are the most robust evidence. But let me first ask you a question. How many of you would agree that in order to know something is true, not believe it's true or wish it's true or hope it's true, to know it's true, you need evidence that it's true, to know something's true? It's a little hard to see, right? To know something's true, you need evidence it's true. And how many of you would agree that to know something is true with a very near certain level of confidence, you need rigorous evidence that it's true? You're being cautious, right? You know something with near certainty. Can you know it with near certainty without evidence? Okay. How many of you know if I toss this apple up, be honest, it's going to fall back down and not float away? So I guess the evidence was very strong. Was it a randomized controlled trial? Was it a meta-analysis? See, I think science is being abused and misused. I think the most robust evidence is remarkably consistent patterns at massive scale on obvious display. And so, frankly, we can know a lot from observation. Yes, we need randomized controlled trials to populate gaps. And later in the evening, if there's time, I'll tell you the specific role of RCTs. They are not the be-all, end-all. They don't answer every question. So you knew what was going to happen to this apple. It's just the consistency of the pattern. So yes, I will talk about the blue zones because there are 5 identified blue zones where people live to be 100 and don't get chronic disease, and they're very diverse. But if we were to plot their diets on a scale from animal food predominant to plant food predominant, they would cluster at the plant food predominant end. They range from mostly plants to all plants, and yes, that's important. And then there's a lot of other evidence. So gene expression, a vegan diet has been shown to upregulate genes that protect against cancer. This is a whole body of literature all on its own. Vegan diets and lifestyle interventions have been shown to grow telomeres, the caps at the ends of our chromosomes that correlate with our longevity. The higher the intake of dietary fat from animal sources, the higher the all-cause mortality. The higher the fat in our diet from plant sources, the lower the all-cause mortality. Exactly the same with protein. More animal protein, more premature death. More plant protein, less premature death. And frankly, the observational evidence just goes on, and I'm not going to characterize all these, right? Enough. Because my only job is to show you that there isn't no evidence and there isn't little evidence, and a lot of this evidence is rigorous. So on and on and on and on and on. Lancet study, 195 countries, more premature death all around the world with more intake of highly processed food, which is also bad. Not all plant food is good, obviously, but more meat and processed meat, lower rates of premature death around the world with more intake of vegetables, fruits, and whole grains. Copy that. The common denominator in all of the literature on lifestyle interventions is plant-based nutrition. And while you may think I'm showing you lots of studies tonight, actually I can't. I can only show you a small sampling because there's just too much literature on this topic. It just goes on and on and on and on and on and on.
Okay, well, there's obviously too many studies to even respond to here. But, it's a fallacy to appeal to authority. It doesn't matter who is right, it matters what is right. We have tried really hard to follow these plant-based, more grain guidelines, and that has not worked out for us. Out of control epidemics of obesity and diabetes and heart disease and cancer and fatty liver disease, that is what we can see with our own eyes without anybody telling us. And we have, since 1970, been eating more and more and more plants foods and fewer and fewer and fewer animal foods. Again, this idea that a vegetarian or vegan diet could even be viable to sustain human life. These are some of the nutrients that you need to get in order to survive. On a vegan or vegetarian diet, you must take supplements. You must especially take B12, which does not exist in plant foods. And many nutrients and supplements, minerals and vitamins that are essential for life are either not available in plant foods or they're in their less bioavailable form. I think iron is a really good example of that. You cannot get from spinach what you get from meat. So I think that is just a critical flaw when you're saying let's assume a vegan vegetarian diet, which we've only had access to like the last 20 to 30, 40 years, is something that we can rely upon for the whole human race. When it doesn't supply the basic nutrients needed for human life, that is a very difficult argument to believe. And then again, there are these anti-nutrients in plant. I think a question you kind of brushed off, but they're very real. They decrease the absorption of iron, protein, iodine, zinc, magnesium, and all kinds of... so it makes it less possible. There are many people who cannot eat these plant foods. Also, you cannot get the long-chain omega-3 fatty acids from plant foods. Flaxseed oil won't do it. So you cannot get those essential nutrients that you need for life from plant foods. Okay, so every study that Dr. Katz showed you after the apple was an association study. That means it's an epidemiological study. That means the odds that those studies would be correct are 0 to 20%. I just want you to remember that. You can show a lot of slides, a lot of data, but if it's not reliable, it is the tragic problem of data not being able to prove cause and effect. And we've seen several of the trials that he showed were by Neil Barnard, who is an animal rights activist who starts with the point of view that we should not be eating animals at all, and that is his starting point scientifically. We've seen it through hormone replacement therapy. We've seen it through being told that we should not eat cholesterol and avoiding eggs and avoiding egg yolks and shellfish, and then that being wrong. Those are the tragedies that happen when you rely on lesser evidence. Clinical trials are hard to do. They are hard to do, but they've been done in the past and they can be done again, and they are the only way that you can show cause and effect. But it's a fallacy to appeal to authority, and you really have to rely on review papers that have done a good job of weeding through good and bad trials. And when you do that, you find there's little or no rigorous evidence for the vegan-vegetarian diet. Despite those incredibly long summary of clinical trials at the beginning, because we were able to scrutinize none of them, and because other bodies scrutinizing these clinical trial data have not found them to rise to the level of being able to endorse them to prevent diabetes, to prevent heart disease, to be included in the dietary guidelines despite a bias for plant-based diets, those bodies did not deem those trials to be rigorous enough. But it's a fallacy to appeal to authority.
Thank you so much for watching. If you want to watch the full hour-long debate, I'll link it down below. But let me know what you think of her rebuttal to Dr. David Katz. And yeah, please subscribe for more. See you soon.